Hey everybody, my name is Eric. I'm a physical therapist. I enjoy running a lot, and I love serving the running community. And yeah, today we're just gonna help understand. Some of you maybe understand low back pain a little bit. I don't know how long this series is going to go, but it at least is going to go into tomorrow. I have someone I'm going to interview on Monday and Tuesday, and then maybe I'll try to finish it up if some stuff is not talked about here. But I wanted to talk about it because it seems like there's a lot of people that are running and have low back pain. Or maybe they would describe it as low back stiffness or tiredness or tightness or pulling or stretching or whatever. And I explained low back pain kind of like this. It's kind of like if you wake up in the morning and you feel your back, you probably shouldn't. It's kind of like waking up in the morning and feeling your ear, right? Or feeling your nose. Maybe something's wrong, right? But I think sometimes we just deal with it because we think we're supposed to deal with it. Everybody has it. But it's not normal. Now, I posted the question a couple days ago, and, I was asking regarding training, right? Well, are you training, and is low back pain limiting the intensity or frequency of your training? And really it shouldn't. Or if you feel it, it really, probably shouldn't. In my opinion, as a rehab specialist and a runner, will you feel it after maybe a marathon, half marathon, ultra? Yeah, sure. Depending on how many hills and all that other stuff. Might you feel some for, maybe a couple hours to a day or so? Yeah, maybe. But during training, it's not normal for low back to limit the intensity or frequency of your training. There's something that's wrong. And just today, I wanted to kind of dive in a little bit to that, and just maybe help you guys understand low back pain a little bit more as far as the anatomy. Now, today I'm going to talk about low back pain as it relates to joint pain, lumbar spine, joint-related irritation, maybe a ligament too, but mostly joint irritated. I'm not going to talk about muscle stuff right now, or peripheral nerve irritation of the lumbar spine, muscles, and skin. That's when it's acutely sensitive, even just a touch, and it really, really hurts just a touch. That's something different than what I'm going to talk about tonight. But so I'm a PT. I know we're all, kind of quarantined or semi-quarantined. Maybe that'll change in the next, hopefully a couple days or so, or weeks. But maybe this is going to be helpful to some of you guys that can't get to your PT, can't get the answers, and that's the desire here that I have to offer you guys something. And so what would aggravate the low back pain in this case, joint-related stuff, is, most of the time it's standing, right? Walking might make it feel a little bit better, but walking also might make it feel worse, particularly if you're walking downhill or running downhill or going downstairs. That kind of thing might aggravate it. If you're sitting, maybe that aggravates it too if you're there for a while. But generally, it'll feel, when it's joint-related pain, generally it'll feel a ton better, or at least a little bit better, when you just simply lean forward and just rest on your knees a little bit, or rest on your thighs, not activating your muscles or anything else. Generally, your low back pain will start to subside some. And these are the guys that feel really good If they're sleeping on their side in the fetal position, generally sleeping on their side in the fetal position with their knees up, like pretty high. Maybe not that high, but you get the idea. It's like sitting on your side with your knees up, maybe a little bit more fetal position. Generally, these guys feel a lot better that way. And sometimes walking will make that feel better because, you might have heard the term or the expression, motion is lotion. Yeah, to a point for the joints in the back. Motion is lotion. The joints don't get a whole lot of blood supply on their own. They have synovial fluid, and that synovial fluid is like this. You can consider it to be kind of oily in a way, to help lubricate the area. And that stuff has to be moving if you're in pain to feel better. So that's why sometimes exercises feel better. And that's why sometimes walking will feel at least a little bit better most of the time. Not all the time, but most of the time. There's some things that can mimic low back pain that is worth noting here. And it's, first off, your kidneys. Someone mentioned it on the post that I put up there. I don't know if it was last week or something, but anyway, yeah, kidneys can mimic low back pain. I saw this. This was fairly obvious to me one day. This is like way early in my career when I was seeing a guy at the VA, Veterans Affairs Hospital, and I was testing out his low back, kind of going through special tests, had him bend forward, he said it hurt, and then he had to go to the bathroom, right? Like right there, had to go to the bathroom, and I thought, okay. So I went to the bathroom, and then I kind of finished up the special test, I had him lean forward again. He said, oh yeah, I feel a lot better than I did a couple minutes ago. And I thought, okay, probably need to consider looking at kidneys. So, he went to his urologist, and sure enough, he had a kidney problem or a UTI or something. I can't remember. Anyway, so something worth all that stuff, worth considering. Liver, gallbladder, can that stuff step in there and kind of mimic low back pain? Yeah, I have a story about a poor guy. He was probably in his mid 80s, and he was pushed in on a wheelchair, feeling pretty awful. And so he came in, and I thought, okay, this might, I was just kind of curious. He's 85, how can I help this guy? Anyway, so I listened pretty intently to the subjective stuff, right? It's awesome, bro, showing it. PT is what we do, man. Try to bring some value to people that really just end up maybe not going where they used to go, maybe about a month or so ago. Anyway, so yeah, this poor guy, and I was going deep into the history, kind of talked to him a little bit more, and it didn't sound like your typical kind of low back pain. So I went up to him, and I probably shows my left side, but this is my, in anatomical terms, this is my right upper quadrant, right underneath your rib cage on the right side. So liver, gallbladder, pancreas, all right there. So I went there, and he said it kind of didn't feel so good. Then I released real fast. That's called a spring test. You can do that on yourself too. So I sprung. I kind of pressed in there, kind of deep. He said it didn't feel that great, but I let go really fast, and oh my gosh, this poor guy, he about flung himself out of that wheelchair at light speed, and I felt so awful. It was pretty awful. So I thought, okay, well, liver needs to get looked at, or at least the liver, gallbladder, all that stuff. So can some of that mimic low back pain? That's what this guy was complaining of. Yeah, it can. So that stuff needs to be kind of looked at. Needs to be addressed. Need to go probably see your primary care guy, every now and then. Sorry about that. But yeah, it needs to be considered at least a little bit. Anyway, so yeah, let's kind of dive into the normal anatomy a little bit here, just to help you guys maybe understand this stuff a little bit more. Calvin, love you, bro. David, Captain, you're awesome, man. Think about you often, bro. Good to see you doing fantastic things. Anyway, let me just kind of turn this bad boy around. All right, so there's your lumbar spine. So That's your sacrum. Right there. That area sits within your two pelvic bones. All right. Right there. I wish I can zero in on this maybe just a little bit better. Let me see if I can. Oh, yeah, look at that. Awesome. Okay, so anyway, your lumbar spine, and right there is the joint. Right there, and right there is a joint. See that line right there? And right there is another joint. All right. So your lumbar spine, let me see here. I'll go over here. There we go. So right here, this is kind of reversed now. That's the back that we were just looked at. That's the front of the spine. But that little cup right there is the other joint partner of the vertebra. Just above that would be going right here and kind of that's how the joint space is created, right? So when you extend your back, let's go back to there. So when you extend your back, they're looking at the back of your low back, right? Anyway, let's turn this around. So when you look at your low back, there's an end range position right there that generally might not feel that fantastic. All right, with people that have joint-related low back pain, you probably would feel maybe just a little bit better going forward. And again, this is kind of the fetal position. This is also sitting down position. And almost, and I see it a lot. And I know that people have certain treatment regimens that they go through, depending on your PT, chiropractor, all that stuff. But most of the time, when it's joint-related low back pain, people do not want to be extended. That's why standing generally over time hurts. That's why walking may not feel that good. That's why going downstairs, because you tend to kind of lean back, or going downhill, tend to kind of lean back and cause some of the pain, right? So when you do that, you end up approximating the joints a little bit more when you extend. There's a little bit more on that, right? As you extend, there's a little bit more going on right there. There's a little bit more compressive force. That's why you just kind of, you get into it, it just doesn't feel good. If you look at the joint structure, that's kind of how the low back is designed. The lumbar spine is designed. There's a joint kind of approximation where it just kind of goes boom, and it just hurts, man. And these guys tend to not want to be in those positions. And if it's you, you're going to know that, right? Standing up is going to be worse. Getting in tight fetal positions is going to feel fantastic. And just caveat, if you guys have low back pain, and you don't have any hip kind of pain going on, getting your knees up as far as you can comfortably throughout the night when you're sleeping is going to give you a fantastic anti-inflammatory all on its own. Now I get it, we all have, certain positions you want to sleep in. Sleep on your side, your back, your stomach, whatever. People that have low back pain, related to the joint related stuff, this kind of what I'm talking about here, you can't spend, I would say, you can't give your low back an opportunity to be irritable. You just can't. You're just allowing this sometimes chronic irritation and inflammation just get worse, and you set it up the next day. If you spend much time at all on your back or on your stomach or you're on your side and your knees aren't really that high up, then you just set it up to be a little bit less successful for what you want to do the next day. And if you wake up with back pain or stiffness or tightness or whatever, chances are you need to be in a fetal position. Chances are you need to be pretty tight. And, I get it. People have their sleeping position and it's hard. It might be difficult to change your sleeping position, but man, it's like if you have knee pain and you kneel down on your knee, is that going to hurt your knee minutes to hours? Yep, sure will. So just consider that, because the sleeping position you're in, chances are you can give it what it wants, 5, 6, 7, 8 hours out of the night. And just, that's a fantastic anti-inflammatory across the board. It just is, okay? Get over it. try to give your back what it really wants, and it wants to be like that. It wants to be in that position. So at least when it's joint related low back pain, it really wants to be there. Let's get into, so, and there's a certain amount of, talk about anatomy a little bit more. So there's a disc between your vertebra, right? There's a disc there. And when you're, maybe in your teens and 20s, you have a pretty fat disc. It's pretty good generally. You got a lot of hydration in with all that stuff. So you have a lot of separation between the vertebra, which means that they have a lot of distance. And those joints I was just showing you, what I'm trying to show you is just the big vertebral body thing, right? Let's go back to this guy. So this is what I'm talking about right here. Right there. These joints guide the motion. Sorry, let me flip you around. Look you down there. Anyway, so what I'm talking about right now is a vertebral body, and you got a disc on top of this thing. Then on top of that, you got another vertebral body, right? That's where your spinal canal and your spinal cord goes up and down, right? These are the joints that guide the motion right there. These things right here. You can see the bottom one just below that, but that's for the segment just below it, right? So anyway, this little C right here, that's the joint guides the motion. Anyway, turn it back around. So the less disc space, and as we get older, there's a tendency to have less disc, right? And less disc and less disc. So there's less range available there. You just less range. There's less range. The joints are closer together. The joints I was just showing you, and the vertebral bodies are just closer together. So it's like trying to find the sweet spot when we age and when we get older. So let me try to show you with my elbow, right? So that's the amount of range that we might have, right, when you're in your teens and 20s. But do it like this maybe. But that range of motion diminishes, and as we get older and older, finding that sweet spot is just a little bit harder. Hopefully that makes sense. Finding that sweet spot is a lot harder. People talk about, core strengthening, and do the core strengthening. That's cool. And maybe you get strong and more fatigue resistant, so you're not towards the end of the range as easy. But if you're training your core right here, you're still going to be pretty close to the end of the range and painful. You might be stronger. You might get away with it for a whole lot longer than you used to. But core strength, my opinion, is great, but you gotta know where neutral is. You gotta figure that out. You gotta be able to, and you can look at your elbow and you can see the range. You see when you're at full extension. You can see it when you're at full flexion. You get that. But you can't see that in your low back. That's why the low back deal tends to be kind of complicated sometimes. What else? I think that's most of what I wanted to talk about tonight. Unless there's questions, go ahead and chime in, man. If there's questions, give me a holler. I'm just kind of blowing through stuff here because I think it's valuable, but I want to key up on some stuff that you guys think is interesting, or something maybe you're going through. But this is about low back pain, joint related pain. And I guess that's mostly it. For now, for tonight. We'll talk about some more stuff tomorrow. About treatment, and how you can actually self-treat yourself with this stuff. And, dry needling help? Yeah, maybe. Spinal manipulation? Sure. But if you're not taught this stuff, you're going to go back. eventually you're going to irritate your back again. It might be months or years, but you're going to irritate your back again, or maybe weeks. But if all you get is the passive treatment, spinal manipulation or dry needling, if all you get is the passive treatment, you're not learning anything. You're not going to know where the sweet spot is for your low back. When your elbow hurts, generally you want to stay away from there, and you know that, and you get that, but you don't know what's going on in your low back sometimes, because you can't see it. That stuff that I showed you, those pictures, you probably might not have quite had a grid for how that all behaves when you have joint-related low back pain. So yeah, hope this helps. We'll dive into it a little bit more, probably tomorrow night around the same time. Then we'll have a fantastic interview about nutrition again, because it's certainly not my wheelhouse. If you guys want to come on, chime in with that, that'd be great. It's going to be good. It's going to be good. Brianne Showman, PT, and has some fantastic nutrition advice for her runners and people that she treats. So that'll be Monday. That'll be Monday, I believe, around, let's say 7 or 8 o'clock. I can't remember, but I'm trying to bring you guys some good value, good content. Yeah, so anyway, hope this helps. Any questions or anything from you guys? I don't know if you're quite comfortable asking questions, but thanks for coming on. Lynn, and Kelly, and Ricky, and Lauren, Jean, June, Marie, blast from the past. Good to see you. Hope you're doing well, Marie. David, and you're awesome, bro. Thanks for coming on. And if you guys are on live, go ahead and hit live if you like. If you're on replay, go ahead and hit replay. Sarah, Renee, Tiffany, Calvin, love you, man. Hope you're doing well. Brandon, Jason, John, hey man, good to see you, man. Thanks for coming on, and I was hoping that I can bring you some value, man. And all you guys, but thanks for hopping on. Eve, changing the world, kiddo. Love to see you. Sandy, Graham, and Jackie. Thanks for hopping on. If you guys missed it, go ahead and hit it. It'll be posted on my personal. I'm probably gonna put it on the my group. Yeah, I'm gonna put it on my group because those guys need to know about this stuff too. So anyhow, I created a group, Running Motivation and Training League. If you guys want to hop in there, we talk about all kinds of great stuff, and the reason for it is just to bring value to the running community and just to bring high vibes, man. Good value to you guys as well. So anyhow, thanks everybody. I'm gonna wave at you all. I guess this is all brand new, but yeah, thanks for everything, and we'll see you guys tomorrow night, probably around the same time. And after that, Wednesday night's going to be Brianne Showman bringing some great stuff and some great value too. So you guys have a great night. Take care, and we'll see you tomorrow. If you guys have any questions, go ahead and hit the questions on this thread here. We'll talk about them tomorrow. See if I can't hit those up tomorrow. Yeah, I got a feeling this might be more than 2 nights, but on Monday night I got to do an interview. So we'll and Tuesday I have to do an interview as well. So we'll probably wait till Wednesday to do it. So take care, guys. Have a great night, and we'll see you again tomorrow.